Stop watching the video this time.
Each day is different for each person. One day you might be bursting with energy because you drank a lot of coffee that morning. The next day you might not be focused at all because you didn't get enough sleep that night. Although these days happen only once in a blue moon for the average person, these kind of days are every day for people who suffer from attention deficit hyperactivity disorder. Having one of those days and having attention deficit hyperactivity disorder, or ADHD, are like the difference between night and day. There are many misconceptions about ADHD, but today I'm going to explain what ADHD is, the signs and symptoms, the diagnosis, and the treatment. Now the real question is, what is ADHD? According to the National Institute of Mental Health, ADHD is one of the most commonly found disorders in children that can continue into adolescence and adulthood. This chronic condition consists of attention difficulty, hyperactivity, and impulsiveness. Although these traits can be found through all children, children who suffer from ADHD show these traits more often and to a higher degree than the average child in their age group. The key signs of ADHD are attention difficulty, hyperactivity, and impulsiveness. Those children who are inattentive can't focus on something for more than a few minutes before they're bored. Hyperactive children are constantly moving and can't sit still. They're the children in the classrooms who are usually running around the room or talking excessively even if no one's listening. Impulsive children don't think before they act. Rather than thinking of the consequences they will reap from their actions, they simply go ahead and do what they want because they're impatient. This makes it hard for these children to play typical games or be more involved with their fellow peers. Although these are the three main levels of symptoms, there are sub-levels under each of these. The signs of inattentive ADHD are the child often fails to give close attention to details and makes careless mistakes in work or during activities. They also have a difficulty sustaining attention in tasks or playing activities, don't seem to listen to when spoken to directly, don't follow through on instruction and fail to finish schoolwork, chores, or duties, have difficulty being organized during their tasks and activities, and they also avoid, dislike, or are reluctant to engage in tasks that require sustained mental effort. They also tend to lose things that are necessarily needed to finish their work. A child who shows symptoms of hyperactive, impulsive ADHD would often fidget with or tap their hands or feet or squirm in their seat. They leave their seat when they're expected to be sitting, and they also run or climb into situations when it's inappropriate. They also have an inability to play in leisure activities and act as if they are always on the go. They talk excessively, blurt out, or answer questions before they're completed, and have a difficult time waiting their turn and interrupt or intrude on others. According to the 5th edition of the Diagnostic and Statistical Manual for Mental Disorders, the essential feature that diagnoses ADHD is inattentiveness and/or hyperactive impulsive. Inattentive and hyperactivity impulsivity diagnoses are given when 6 or more of the symptoms are shown and have persisted for at least 6 months to a degree that is inconsistent with developmental level and negatively impacts directly on social and academic activities. The diagnosis of attention deficit hyperactivity disorder is easy to attain if the child is in the correct setting, but it can be extremely difficult if they are put in the wrong setting. For example, a child in the classroom who is around children their age would be typically easy to diagnose because they're in a setting where there are children their age. So they're more prone to run around, be loud. They also, if they're inattentive, they're not focused on the games, they're distracted, things like that. But if you have a child in a different setting, such as a doctor's office, and it's just you and the child, then those symptoms are less likely to come out because there's nothing that is exactly it's not stimulating. According to the Center of Disease Control and Prevention, there are various forms of treatment that are being offered for people who suffer with ADHD. One route to go is medications. There are two types of medications that are typically given. They are stimulants and non-stimulants. Stimulants are the best known and most widely used treatments. Between 70 and 80% of children with ADHD respond positively to these medications. Non-stimulants were approved for children suffering from ADHD in 2003. This medication seems to have fewer side effects than stimulants and can last up to 24 hours. Medications can affect children differently, where one child may respond to one medication but the other may not. Another route is behavioral therapy. Research shows that behavioral therapy is an important part of treatment for children with ADHD. ADHD affects family and how well they do in their classes. This treatment option can help reduce the problems for children and should be started as soon as the diagnosis is made. There are other things that family members can do to help the children's ADHD become more easy to cope with, such as limiting their choices, using goals and rewards, and using the correct form of discipline. Through using these different types of treatment, many people have seen improvement and can now live easier lives. Attention deficit hyperactivity disorder is something that many children suffer with throughout the country. Although a child has this disorder, through diagnosis and treatment, the child at hand can have a normal life, even though they have these symptoms.